Hello, everyone. My name is Dr. Oriana Lowe. I am a pediatric dentist practicing in Los Angeles, California. I am presenting to you a lecture on special needs patients or patients with special healthcare needs. As many of us know, these patients are very difficult to treat in the office setting, especially if we don't have that much experience treating this type of patient. So what we're doing today is we will be going over the most common conditions in patients with special health care needs. We're trying to understand treatment consideration for these patients and recognize common intraoral findings in these patients. The course goal is to prepare the student to recognize and treat the oral conditions of patients who present with special health care needs. To begin with, disparities in oral health delivery and treatment exist. Children with SHCH account for 13% of the US population. Children with special health care needs have disproportionately more oral disease and more challenges with accessing dental care services than children that have no special needs. Special needs children experience higher unmet dental needs than the general population. What is special health care needs? What does that encompass? That encompasses any physical, developmental, mental, sensory, behavioral, cognitive, or emotional impairment or limiting condition that an individual may present with. The condition may be congenital, developmental, acquired through disease, trauma, or environmental. This may impose limitations in performing daily self-maintenance activities or substantial limitations in a major life activity. The Academy Guidelines on Definition of Special Healthcare Needs is a great resource to look up and read about how to treat these special patients. So let's begin with patients that have this diagnosis. This condition includes patients that are diagnosed with Tourette syndrome, Down syndrome, Asperger's, Marfan's, cerebral palsy, and the autism spectrum, and many other diseases that may not be as well known, but these are more of the common conditions. So, to treat a patient with special hair care needs, we have a multidisciplinary and an interdisciplinary team that collaborate. Multidisciplinary is a group of healthcare workers who are members of different disciplines, such as psychiatrists, social workers, each providing specific services to the patient. The interdisciplinary team is a group of healthcare professionals from diverse fields who work in a coordinated fashion towards a common goal for the patient. Children with special health care needs, 78% were reported as needing dental care in 2001. These patients have reported more insurance than children without health care needs, but have more unmet preventive dental care. Children with Down syndrome have the highest proportion of unmet dental needs than children that do not have this diagnosis. And why do you think this is true? Part of this is true because we don't have a large enough population of dentists and healthcare providers who are willing to see and treat special needs patients. There are many barriers that exist that prevent children from accessing care. Some of these include, sorry about that, barriers to transportation, low socioeconomic status, parental anxiety, dentist anxiety to provide care, and cost of care and language barriers. All of these play a part in why healthcare for this particular population is lacking. Dental standards for dental offices should be followed. All doorways should be 32 to 36 inches to allow for wheelchair access. This includes restrooms, waiting rooms, and operatories. Hallways should always be at least 36 inches for standard wheelchair access. Wheelchair ramps have a 1 to 12 maximum slope. Appointment schedule for these type of patients needs to be taken into consideration. These patients may need additional time to complete certain procedures. Early morning appointments is generally recommended. These patients have reduced sensory stimulation, and which we need to know about, and staff training is important. Our staff needs to be able to work with these patients and be passionate about giving care to these patients. The dental home and special healthcare needs. What is the dental home? The dental home is an ongoing relationship between the dentist and patient, inclusive of all aspects of oral health care delivered in a comprehensive, continuously accessible, coordinated, and family-centered way. The dental home should be established no later than 12 months of age, which includes referral to dental specialists when appropriate. When assessing the patient with special health care needs, a thorough medical history is essential to providing safe and quality care to these patients. These patients may require medical consultations and clearances prior to any treatment, such as patients with cardiac conditions associated with subacute bacterial endocarditis. We need to know whether these patients need to be prophylaxed before treatment. We should know a bit about their social history, previous dental history, any allergies, sensory issues, and their ability to communicate verbally or non-verbally. For preventive care for this population is important. It includes, and it should include, frequent dental recall visits every 3 to 6 months, depending on the caries risk and hygiene. Professional fluoride applications every 3 to 6 months, also depending on caries risk. The visit should be tailored to oral hygiene instructions, sensitization, needed knee exams for home care, and adaptive toothbrushes. A good website to review is adaptivetechsolutions.com. The visits should be tailored to these patients. So here we have a little photograph of how we are examining the patient and giving care. There are special toothbrushes that have bristles on 3 sides that are purchasable, as you see in the picture here. The picture on the left shows a lap exam and toothbrush prophylaxis, where the mother and the dentist are both caring for the child, and the dental assistant is on the side ready to help. Some special dietary considerations that need to be considered when treating these patients. There's some of the special needs patients have gastro tubes. This is a tube that's inserted through the abdomen and delivers nutrition directly to the stomach. Many of these kids have high-calorie diets or liquid diets. And if they are taking medications, oral effects of certain medications causes dry mouth or xerostomia. Behavior management of these kids are very challenging. You need to know basic behavior guidance techniques and advanced behavior guidance techniques. You may need to have every tool in your toolbox to treat these patients. Now we'll go into special topics, starting with developmental disorders, Down syndrome, cerebral palsy, and autism. These are special needs that present with developmental disorders. Some patients have pulmonary disease, and you see this with asthma and cystic fibrosis. Developmental disorders and Down syndrome. A genetic disorder of chromosome 21 results in a distinct facial appearance and intellectual disability and developmental delays in this patient. There are 3 genetic types of Down syndrome. You have trisomy 21, which in 92 to 95 of all the cases present with this. In 3 to 4 cases, you have translocation of the 21st chromosome. And in 2 to 4%, you have mosaicism, which is extra chromosomes in some cells, but not all. And this is the most mild form of Down syndrome. Life expectancy of these kids in the United States is 55 to 60 years of age. There are some distinctive features prevalent with the Down syndrome patient. For the face, you have epicanic folds at the eyelids, a broad nasal base, frontal bossing. Many of them are mouth breathers, and they have an underdeveloped midface, such as here. You have the underdeveloped midface, as you see, frontal bossing, and epicanic folds around the eyes. What are some potential health complications for the patient with Down syndrome? You have neurologic considerations. The intellectual disability is greater in 95% of these patients. 1% have atlantoaxial subluxation with spinal cord compression, leading to atlantoaxial instability. And this is a reason why it's very difficult to give the Down syndrome patient general anesthesia. Many times the anesthesiologist is reluctant on treating them, especially with IV sedations where you have to protect the airway. Intubation of these patients is a little safer, but it depends on the comfort level of the anesthesiologist. 5 to 10% have epilepsy. They have an increased incidence of seizures and hypotonia. Dental implications that you should know about is you need to be very careful when manipulating the neck because of the atlantoaxial instability. Consider screening films before treating patients in the operating room. You can ask for these lateral neck x-rays before you undertake treating them in the OR. Other potential health complications with Down syndrome include cardiac conditions. 50% have congenital defects. Structural problems with the formation of the heart are common. Valvular disease is common later in life. As these patients age, valvular damage increases. These patients have 40 to 75% hearing loss. Many of them will present in their older age with hearing aids. They have problems with the endocrine system. 5% are known to have hypothyroidism, infertility, and growth retardation. 1% of the patients develop leukemia. So when I worked at the City of Hope Hospital, we had a Down syndrome clinic. And I would have to say like 30% of the patients we saw with Down syndrome were diagnosed with leukemia. These patients are also have an increased susceptibility to infection because their immune systems are generally compromised. So what do we have in terms of dental anomalies? we see delayed eruption, malformation of the teeth. Many of their teeth have shovel-shaped incisors. These patients will present with missing or extra teeth. They have increased susceptibility to periodontal disease due to a decreased activity of polymorphonuclear leukocytes. They have macroglossia and have high arched palates. And here you go, pictures of some Down syndrome patients. Most of them have the large tongue, and the tongues are usually protruding from between outside the mouth. So now let's go and talk a bit about cerebral palsy. Cerebral palsy is a developmental disorder. It falls within the spectrum of neurodevelopmental conditions resulting from a non-progressive insult to the developing brain. It manifests as deficits in motor functions and may be associated with additional defects in cognitive, sensory, and other areas. It's found that cerebral palsy can present itself in 1 to 3 per 1,000 births. The incidence increases with decreased gestational age and decreased birth weight. The etiology has many different causes. One of the causes that's very high is up to 95% of full-term infants that experience asphyxia on birth, and this is one of the causes of cerebral palsy. Classifications of cerebral palsy, there are different types. The first type that accounts for 75 to 80% of CP patients is spastic. This includes the hyperirritability of involved muscles, resulting in exaggerated contraction when stimulated. The muscles are generally contracted and tense. They have limited control of the neck muscles, resulting in a head roll, and they lack control of muscles supporting the body. Another category of CP is spasticity. This is characterized by a lack of control of muscles supporting the trunk. Contraction interferes with the normal movement, speech, or gait. It's caused by damage to the brain and spinal cord that controls voluntary movement, such as this. This is like a spider walk. Another classification of CP is dyskinetic or athetoid. And this is seen in about 15% of all the cases diagnosed. Constant and uncontrolled motion of the involved muscles is seen in many of these cases. Succession of slow twisting or wreathing involuntary movements, which is referred to as athetosis, or quick jerky movements, which is choreoathetosis. You also see the possibility of frequent uncontrolled jaw movements causing abrupt closure of the jaws or severe bruxism. Often seen as hypotonicity of periodontal musculature with mouth breathing, tongue protrusion, and excessive drooling. And finally, another classification is ataxia. This is seen in approximately 5% of the cases. This is characterized with inability of involved muscles to contract completely. There is a poor sense of balance and uncoordinated voluntary movements. There is possibility of tremors and uncontrollable trembling or quivering on attempting voluntary tasks. And finally, you have a classification categorized as mixed. This is seen in approximately 10% of all the cases. It's a combination of more than one type of CP. So here you have a picture that shows how partial involvement may involve, due to the injury of the brain, and compared to total body involvement. You have hemiplegia and partial involvement, and diplegia, which is spastic. Then total body involvement includes ataxic, dystonia, athetoid, and quadriplegic. Associated conditions seen in cerebral palsy includes vision. Greater than 50% of these kids have vision defects. 10 to 20% have hearing problems. Many of them have difficulty with feeding and swallowing, and GERDS is common. Communication and speech difficulties exist. Some of them are nonverbal. Some will learn how to verbalize or communicate through use of a computer keyboard. 45% have seizure disorders, and many of them have respiratory problems or congestion from lying down. Treatment of the spasticity that you see in cerebral palsy includes spasticity meds such as baclofen, Valium, and dantrolene. You can have tendon release surgery and therapy, which includes physical therapy, occupational therapy, gait and speech training. So dental management of the cerebral palsy patient, what do we need to know? We need to know that we have to have suction at the chair side. You can treat the patient in the wheelchair or the dental chair. If they're light enough, the parents or the care provider can help you carry the patient onto the dental chair. Otherwise, if the patient is too large and very difficult to transfer, you may want to consider doing their dental work in the wheelchair upright. TLC, tender loving care, is welcome. Many of the CP patients will understand and will react more kindly to you if you show them more passion or compassion. Someone that comes to them and tells them to open the mouth and that's rough with them, they're not going to be as agreeable with your commands. You must use caution. Sedation and general anesthesia is usually the best way to treat them. And if the patient is small enough or can get into an immobilization device, that would be helpful to use in treatment. The dental implications of CP patients include impaired swallowing and reflex, crowding and malocclusion, periodontal disease, and dental caries. Many times that dental caries is uncommon because these patients present with increased drooling. And as you know, saliva is a protective element in the mouth. They do have increased gag reflexes, so just be careful when you're treating these patients. You do have the suction ready and pull back if you see that the patient is starting to gag. Many of these patients may need adaptive equipment for oral hygiene due to lack of muscular control or coordination. So many times the toothbrush that they may use, you can have, or you can order special elongated handles that you can put on the end of the toothbrush. The same with a flosser. You can extend a flosser with the handle, and the flossing can go between the teeth and they might be able to maneuver it. Care providers may, or caregivers may also use or start using electric toothbrushes versus mechanical brushing. Many times the CP patient has a crouch gait. This is characterized by excessive dorsiflexion at the ankle, combination of hip flexion and knee flexion, dorsiflexion at the calcaneus at the ankle, and flat feet. So now we'll talk a little bit on autism. Autism is a developmental disorder, and it is put into the autism spectrum disorder. Autism is a complex neurobiological pervasive developmental disorder that affects speech, social skills, and behavior. It ranges from mild to severe, and expressions of symptoms varies greatly. These are autism and ASD are abnormalities of the cerebellum and limbic system. With autism, many times we see severe language problems, and they may be nonverbal. There's a lack of interest in others. They demonstrate repetitive behaviors, resist to change. They display irrational routines. They have sensory sensitivities to light, sound, touch, and texture. Another category under autism spectrum disorder is Asperger's. An Asperger patient has relatively strong verbal skills. They have difficulty with social interactions and sharing, and they have obsessive interests. Another category of ASD is pervasive developmental disorders. These kids are characterized with less severe social impairments. Some of them have rocky movements and flapping of hands. Childhood disintegrative disorder, or CDD, presents with a normal growth and development for 2 to 4 years of age. They have autism-like symptoms that develop at some point before 4 years old, but not present early on. Rett disorder occurs primarily in girls. They have normal birth and development until 18 months to 2 years of age, and then there is complete regression. Early signs of the spectrum includes avoiding physical contact, language milestones are absent, there's no babbling, there is no response to their name when being called, they lack eye contact, they are insensitive to pain and prone to self-injury, and many of them do not point or gesture by the time they are 1 year old. Dental implications of these patients include no specific dental anomalies. The medications they take may cause xerostomia. There is increased risk for dental caries and periodontal disease. The dental setting may trigger anxiety. Tactile and auditory sensitivity may be heightened. Oral sensory areas may cause them to become very anxious. And many of them think that you are invading their space, especially when you come at them with a mirror and explorer to look into their mouth. That's their space, not yours. So there are strategies to help to prepare for the visit with these patients. Preparation includes informing the child well in advance that they will be going to the dentist on a certain day at the specific time. There are social stories that you can tell and get them to try to understand what the purpose is. You can break down the dental visit with visual supports, and time indicators are important during the visit. Comforters and distractors can be used, such as stuffed animals or picture book or a YouTube video or just videos on an iPad are helpful. Dental management of the ASD patient includes treating in the wheelchair or the dental chair. You can treat them on the floor if the operatory has a carpet. Again, with TLC, use caution. Sedation and general anesthesia has been very helpful, and use of immobilization devices. In summary, communication problems and mental capabilities are key to understanding how to treat these patients. Communication and mental capabilities are major concerns. with people with developmental disabilities. Talk with the parent or caregiver to determine the patient's intellectual and functional capabilities, and then communicate with the patient at their level. Use a show, tell, do approach to providing care. Start by explaining each procedure before it occurs. Take the time to show what you have explained, such as the instruments you will use and how they work. Demonstrations can encourage some patients to be more cooperative. In summary, the child with special healthcare needs, there remains considerable disparity in the ability to obtain the needed dental care for these patients. 78% were treated in 2001, 81% in 2005 to 2006, so we're getting better. We have found that poor and low-income children have more than 13 times the unmet dental needs compared to higher income children with special healthcare needs. Children facing the double disparity of poverty and severe chronic conditions deserve special attention. And that concludes the lecture for today. Please let me know if you have any questions. You can send me an email. Thank you for your attention.